So the situation with Viggo right now is that he's being bothered by a couple of infected cysts. He has one on his upper back, around his shoulder blade, neck area, and one sort of on his butt. And what happened the other day was that he scratched at one that had gotten quite large and it tore open. And it needed immediate attention. Pus started leaking out of it, and Bryan needed to hop in and do something immediately because the vet was already closed. So, fortunately, Bryan has medical expertise, and he's trained to actually handle these kind of situations. So he's putting on a hot compress right now to kind of prepare the site. But he's actually going to do a quick stitching up of the cyst, and then we'll take Viggo into the vet later.
Oh, it still looks pretty big.
Oh, it's big,
What are you doing, a hot compress?
Hot compress, yeah.
Mm.
Even though it's already...
It's pretty much out of head, I think.
Yeah.
I don't think you need to... I don't think it needs any more help.
I want it to be loosened up as much as possible.
Mm. He must have scratched it today, and then it popped open. Okay.
Yeah. Well, the capsule.
The capsule's thick, okay.
Most of the goo is out already.
Oh, okay.
Shave it down some more before I...
Suture it up.
Well, it needs to be cut open and pulled out.
Mm.
To provide an environment as sterile as possible, Bryan's shaving away the fur. And Viggo's being very patient with the process. But Bryan's definitely got to get in there and fix it.
Looks like it's time for surgery. Just like your old days.
Yeah.
In the hospital.
Yeah, except that was in the hospital.
It's going to be less, what is it, more stressful or less stressful with a furry
Viggo.
patient instead of a human patient?
Come on. Viggo.
Someone doesn't want to come over here.
Come.
Yeah, you can we made a Viggo bed for you right here.
Right,
yeah, I can lie down on it.
Yeah, perfect.
Ugh.
Perfect.
It's funny that you were preparing for this all week, getting all your supplies, and now it's like...
I forced my hand.
Yeah, you forced your hand. What's that, the lidocaine?
Yeah.
Okay, so we thought we need to do a little public service announcement here. You're watching Viggo on the floor getting injected and stuff. Looks kind of iffy, but as a reminder, Bryan is a trained medical professional with a medical degree from Wake Forest University.
Yeah.
So he does this kind of thing for a living, not operating on cysts really, but
I've done that before during training and stuff.
Yeah, he's actually done it on humans in the emergency room.
Right.
So okay.
And Viggo's tougher than most humans. So.
was tough. And you know, had lidocaine and all of this stuff. But we did want to bring up this break in the presentation to kind of talk about something important when you do live rurally. What kind of skills are helpful? Some people use the word bush medicine.
Right. So,
But-
you know, we're a good 45 minutes to an hour away from any kind of emergency facility. We'd have to call an ambulance or something like that.
Yeah. We do have emergency, you know, we have ambulance and paramedics up here, but we don't have urgent care. And we don't have a hospital within an hour.
All right, so if you had a significant cut or something, can you take care of it yourself, or do you need to go find somebody to take care of it? So, some basic things you can have on hand, that would be helpful.
So not that you need a medical degree, but you can definitely take courses. I think it was
Right.
a course you took a few years back.
Wilderness medicine.
Wilderness medicine, yeah.
I was actually down in Boulder before we even moved here. So, and I think that particular course is offered all over the country. So,
So let's review some of the things that are helpful to have on hand for situations like this when your animal gets injured and you can't take it to emergency vet right away, you know?
so we, these are just kind of some basic things. A pair of gloves. I even have some sterile gloves here. Some flushes, just saline flush. I used this on Viggo. I actually mixed it with some betadine, antiseptic, and then just flushed out his cyst with it. And then some hemostats, something that you could put some. If you had to lock it, you could lock it. I used it to hold the suture needle, and then certainly something to cut with, and not just your run-of-the-mill scissors, but something that's a little more, surgical precision, or it's going to be sharp, and they're pretty small to keep with you. If you're on a backpacking trip or something, you're miles and miles away from anybody. It'd be nice to have. In fact, interesting story. I was backpacking with my dad when I was in high school, and the first night he chopped his finger with the hatchet almost down to the bone. So, if we didn't have these things, he cleaned it out as best he could and, put a nice tight Band-Aid on it, but he probably needed some stitches for that. And even if you put one just to hold it together, it'd be helpful. Some gauze, something to kind of dab and clean with if you need to.
And a lot of these things you can get on the internet, would you say?
Absolutely, you can buy sutures on the internet. But these were expired from work, so I was able to get them from one of the surgical PAs, which was nice. They're still good enough for you and me. I mean, if it's an emergency situation.
Emergency situation,
not like
keyword.
They're completely sealed up, so. But everything has an expiration date, so you're not going to use it in a hospital setting if it's expired.
Right.
No, lidocaine, that's good for numbing up your skin. You certainly don't want to use. Normally, you would use, if you're cut on a leg or something, use a little epinephrine in there as well. That helps kind of constrict the vessels so you don't bleed as much. You don't use that on fingers and stuff, so you just use the lidocaine. I don't know if you can buy that online or not, but you can pretty much buy anything online nowadays. And then, a little topical antiseptic maybe. But, this is really good for just cleaning the wound initially. So
Yeah, so that's betadine, iodine, that's Walgreens, you got it. So
Providone, iodine, it's not the kind that stings real bad.
Okay.
So
okay.
certainly
Yeah.
when I was using it on Viggo, he didn't even flinch. So
Yeah.
but I did numb him up a little bit. So I don't have any more syringes, just empty syringes, but a syringe with a needle if you need to get the lidocaine out. You certainly need something to get in there with. This is the blunt needle. I think you can stick it through there to get it out, but
What's the blunt needle do?
it's just it's not sharp.
Okay.
So a lot of times you use it to get some medicine out of a container, and then you.
Okay. But a variety of bandages, it's good to have on hand.
Absolutely, and then something else I don't have, an ace bandage, something to wrap with if you need to make a tourniquet. If you really hurt your leg and you need to make a tourniquet, some paracord would be helpful. There's all kinds of things online. Making a handle out of paracord, so just in case you needed a bunch of paracord, you've got this really tight wound thing on your backpack or something, and then you can unwind it. So, a paracord would be good. Ace bandage, stuff that's relatively light, but you got a lot of it if you need it. And around here there's sticks everywhere, so if you had a splint or a limb or something, you just grab a stick. So,
Okay.
but if you had to make a tourniquet, then the paracord would help, a belt or something like that. So, but these are just kind of some basic things to, it's kind of more than just a Band-Aid, right? So,
Yeah.
Certainly getting something clean right away is important. Because, around here, it's so dusty and dirty right now. And I cleaned Viggo up pretty good with that before I even did anything. So, but
Okay. Well, cool. Well, maybe we'll have to do another video sometime of some emergency medicine, bush medicine, to get more thorough, because I'm sure this is just the tip of the iceberg, but it's kind of a good basics.
yeah, basics.
So overall, Viggo's going to be okay. So I think what's going to happen is the stitches that you put in are...
Just kind of holding it intact right now. It's, really you would, if I had some iodoform kind of packing, it's like a 1/4 inch strip, comes in a bottle, and you just pack it in the wound afterwards to help kind of drain it. You put a stitch or two in there just to hold it together, but then that actually is open to the outside, and then in a couple days you pull it out, maybe you repack it again. But his cyst, the capsule on it is so thick and rubbery that it really just needs to be cut out. So they just cut an oval shape around it, and then his skin is so easily moved, you can just cut that out and then suture it together. So.
But that's not something we're doing here.
Right.
Yeah. That's something for the professionals. But
yeah, he really needs to be sedated for that.
Yeah.
He was wiggling around enough just for a few sutures, so...
Yeah. Well, yeah, we got most of it on video, but then I had to hold him while he was finishing up, because it's not that it bothers him, but he just loses patience and he's kind of done with it. So he's kind of like, okay, I'm done. I want to be done with this, whatever we're doing.
Exactly.
And so he just gets antsy, and so
it didn't hurt. He wasn't hurt at all.
yeah. So.
Right.
But yeah, just because it was open and he was scratching at it, it was just something we had to take care of immediately. Just because we knew it was going to take a day to get into the vet up here, and
if he had scratched it even more, the whole thing could have been wide open.
Yeah.
So that would have been gross.
Yeah. So kind of great first aid skills to refresh on, but we're looking at getting Viggo back to the vet and to kind of finish up all of that with a veterinarian medicine. Okay.
Yeah, absolutely.
But I hope you guys enjoyed the little sort of emergency medicine presentation, just to kind of, before anybody gets too upset that we're just poking around on Viggo, playing around, and actually know what we're doing. So,
Exactly.
Okay. Going to go to the vet, get checked out. Look like you're doing better today. Yeah. Still a big ball. Yeah.
Yes, it needs to be cut out.
Yeah. Might need to be having surgeries today.
Yeah, they might reschedule.
Yeah. Time to go. Going for a ride. Oh.
Oh, you like that?
Oh yeah, he loves it. Loves to go for those carbs. Ouch. Oh, jeez.
Oh, I need
Okay. So what did the vet say?
She said, "Oh, it looks good. It's not red."
So she wasn't concerned about it,
No, not at all.
but you discussed.
Discuss packing it with something. I said I didn't have any packing to put in there. She didn't seem to want to do anything about it. I said, "Well, I'd like to get it removed because every time he
Yeah.
hooks it, he's going to rip it open again."
Right.
So we're going to give us an estimate,
Okay.
and then we could schedule it for within the next couple of weeks or something. Yeah. And you did good job too. Yeah, you were very relaxed. You didn't get too.
You got to go inside.
No.